everyone. It's William here at Junilai and Williams Adventures. Outside of Philadelphia, still house selling. Thought I'd come back to you again with a subject that we want to talk about today, which is healthcare coverage in the Philippines. I was talking to one of our subscribers, and I shout out to Henry, who's one of our subscribers here at Junilai and Williams Adventures, that we were talking on the phone, and when we talked, it came up that he was planning on transitioning to the Philippines in the future, not too distant future. And we talked about healthcare coverage. Remember, everyone, if you're over 65, Medicare Part A and B does not cover you in the Philippines. And so you're going to need an insurance unless you have an Advantage plan, which any of you that have, that would cover you in the Philippines, if you have such an Advantage plan, put it in the comments, guys, so that other subscribers can know about it. Because one of the things, if you're in your 60s, you're going to need is health care. My wife and my daughter, by marriage, have Pacific Cross, which covers them. They're young, so it was pretty inexpensive to cover them, pay a yearly rate, and it covered them inpatient stay for any purpose at any hospital, mostly that are in the area of the Philippines. For myself, that's over 65. I'm 68. And healthcare coverage is a little higher for someone in that age category. So I have a coverage out of Thailand. If you want to know what that is, ask me a question in the subscription or in the comments. I'll be glad to tell you. But it covers me if I'm in Thailand or if I'm in a chain of hospitals, certain hospitals in the Philippines. Some that are close to me in Lapu-Lapu, some in Manila, and on different islands. And it's 100% coverage, but it's only inpatient coverage. Remember that your Medicare Part A and B does not work in the Philippines. So if you're paying a premium out of your Social Security check, remember that's only if you're in the USA. A lot of people have said, well, if I get sick, I'll go back to the USA and I'll use my coverage. Well, what if you have a heart attack or a stroke or some major illness, guys, and you're not able to get on the plane and go back in an emergency to the United States? Then that Medicare Part A and B would be useless to you. And they're taking a premium out if you're living in the Philippines. Remember, we're not talking about vacation. If you're planning on going on vacation in the Philippines, we suggest an insurance that I always use when I was going on vacation, which is Safety Wing travel insurance. You can look on our channel links and you could see Safety Wing travel insurance. Check it out, guys. And it doesn't cost anything to see the prices. Push that link. It'll take you to where it'll give you, for your age, different prices. That's if you're going on vacation. But if you're transitioning to be an expat and live for any amount of time in the Philippines, retire in the Philippines, you're going to need insurance. Pacific Cross is good if you're under a certain age, under 62, under 65, I believe it is. Very good. I know different brokers that work well with you, very well. But if you're over 65, it's going to be a little more expensive. I found one that I could pay, which I said, the healthcare in Thailand is very good. If you're able to find out you have an illness and you can get to Thailand, then that is a good place to get healthcare coverage. Even though they do have good hospitals in the Philippines, in Manila, St. Luke's, in Cebu City, and mostly around the major cities. And remember, guys, if you're relocating to the Philippines, depending on your health, should have some say-so on where you're going to stay. That's the other question I've been asked a lot. Location depends on your health, in all reality. So I suggest that you get a general practitioner in the Philippines that you visit every 6 months or whatever your health dictates that you need to see. Get wellness checks. Don't wait till you're sick to go see the doctor. And if you develop a relationship with that doctor, if something is happening in your blood work that you get every 6 months, every year, and he sees something coming down the road, then you have time enough to get on a plane and go to Thailand. I'm not sure if Guam is still, even though it's an American territory, if it's accepting U.S. citizens. That's another option, I believe. Let me know if that's still an option in the comment, fellas. So once again, we're talking healthcare here at Juni Lai and Williams Adventures. Mainly if you're over 62, 65. Remember, Medicare Part A and B does not work in the Philippines. So what do you do about one of your most valuable assets, which is, besides your money, is your health? You want to make sure that you get yourself a regular checkup, a wellness check, blood tests, get your eyes examined. Do a lot of these things before you go to the Philippines, but also ongoing health care. That's the one thing that would be important, along with budgeting your money properly. But that's what one of our subscribers and I were talking about. I suggest that that's what you do if you're going to be living in the Philippines. Number one, take care of your health. Get all the preliminary checkups and diagnosis and blood work, and take care of everything before you transition, along with all the other nuts and bolts items. Make sure of your health, which a lot of guys neglect. Remember, if you're going to the Philippines and you're going to be in a relationship with a younger woman, you want to make sure about your heart. You want to make sure that everything's working in proper working condition, gentlemen. So once again, subscribe, give us a thumbs up, and please comment. Let us know, what do you do for your health care in the Philippines? Do you have inpatient care along with your outpatient care? If you're under 65, it's less expensive. If you're over 65, it's more expensive. And a lot of the people that are transitioning to the Philippines are over 65. Are you going to still pay for your Medicare if you have enough in your budget and keep it going in the United States in case you need to go back and have something done? A lot of guys can't afford to pay for their Medicare Part A and Part B and have that $175 to $200 coming out of their budget, and they're not using it. And remember, if you're in an emergency, as I said, with a stroke or a heart attack or something other emergency, you're not going to be able to get on a plane and go back and use your Medicare. So you'll need to have insurance in the Philippines. If you have a potential wife or a girlfriend, that's something else that you'll have to think about. Coverage for them, if you choose to do that, is much less because of their most likely younger age. So once again, we're not going to talk a long time about it, guys, but remember, healthcare in the Philippines, it's a subject that needs to be discussed. As I said, I found a healthcare policy that is out of Thailand. It works in Thailand, and it also works at certain hospitals in the Philippines that are in the area I live in. And that's for inpatient care. We suggest a general practitioner that you get to know regular, that you see and get wellness checkups. Make sure of those things. Dental work is inexpensive in the Philippines, so you could pay for that probably out of pocket. Also, most outpatient things could be paid for out of pocket because it's inexpensive mostly. But an inpatient stay is something that you'd want to make sure that you had insurance for, gentlemen. So once again, let us know what you think in the comments about healthcare in the Philippines. That's what we were talking about, and we'll look to see you next time here at Juni Lai and Williams Adventures. Remember, enjoy every day because tomorrow's not promised, and we'll see you next time with something different. Till then, see you later, guys.